Welcome to Insider Medicine in Depth. Taking antiretroviral therapy may actually help reduce the risk of transmitting the HIV virus to a partner, according to research published in the Lancet. Here are some 2008 statistics on HIV and AIDS. Over 33.4 million people worldwide were living with HIV. New HIV infections occurred among 2.7 million individuals, and AIDS caused 2 million deaths. Researchers from Fred Hutchinson Cancer Research Center studied the transmission of HIV among over 3,000 adult heterosexual couples in Africa, one of whom was infected with HIV and the other of whom was not. At the outset of the study, none of the infected partners were taking ART because they had not yet experienced a substantial enough reduction in their immune system cells to meet national guidelines for the use of these drugs, which are only available in limited quantities in Africa. The couples were followed up regularly over a 2-year period, with the infected partners receiving ART as their immune cell counts fell within the levels recognized by national guidelines. Overall, 10% of infected partners started on ART therapy during the study period. While the HIV virus was transmitted from an infected to an uninfected partner 103 times during the same period, only one of these transmissions occurred in a couple while the infected partner was taking ART. Overall, ART therapy reduced the risk of transmission of the virus by 92%. The benefits of this therapy with respect to preventing the transmission of HIV increased as the infected partner's immune system cell counts dropped and the concentration of HIV virus in their blood increased. We had a chance to speak with Dr. Deborah Donnell, the principal investigator of the study, who offered some further insight.
So in the study that we published in the Lancet today, through following heterosexual serodiscordant couples in this study in Africa, as we looked at the infections that were being passed from the HIV-infected partner to the uninfected partner, we looked at, as people went on treatment for their HIV, whether or not that changed the infection rate that we were seeing between these discordant couples. And we discovered that after people went on antiretroviral therapy, that the seroincidence that happened to their partner, the infection of the partner, dropped by a pretty dramatic 92%. So while we only saw one infection to an uninfected partner after people went on antiretroviral therapy, for those people who didn't go on antiretroviral therapy, we saw a much higher rate of infection, amounting to about 2% per person year instead of about 0.5% per person year. And so from the study, we're concluding that antiretroviral therapy really has a dramatic impact in preventing the transmission of HIV.
Today's research suggests that tailoring antiretroviral therapy to HIV-infected individuals' immune cell numbers and viral loads in countries where ART therapy is limited might help reduce the transmission of this disease. For Insider Medicine in Depth, I'm Dr. Susan Sharma.